You know that sound? That constant jingle of a collar, the thump, thump, thump of a leg against the floor, or just that endless sound of licking. You look over and there's your best friend, and they just can't get comfortable. They're scratching, they're chewing, and they're clearly miserable. And your heart just sinks, right?
And you start to wonder, is this just a normal itch, or is something else going on here? Is this serious? What am I even supposed to do? That feeling of not knowing how to help is just the worst.
So if you're seeing your dog constantly licking their paws, maybe rubbing their face raw on the carpet, if you're seeing angry red skin, or you feel like you're dealing with the 10th ear infection this year, you are absolutely in the right place. In the next few minutes, we're going to uncover what could be causing all of this discomfort, and most importantly, how you can help your dog find some real, lasting relief.
Okay, so let's get right into it. To really understand what's happening with your dog, we have to know what an allergy actually is. And at its core, it all comes down to a simple but powerful overreaction.
Right, so an allergy is basically the immune system getting its wires crossed. It starts treating something that's totally harmless, like a bit of pollen or a protein in their food, as if it's a dangerous invader that needs to be attacked. You know, the easiest way to think about environmental allergies is to compare it to hay fever in people. The big difference is, instead of a runny nose and sneezing, your dog's main symptom is just intensely itchy skin. So when we start playing detective to find the source of that itch, we've always got three usual suspects. First up, fleas. And believe me, for a dog with a flea allergy, it only takes one single bite to set off a huge reaction. Second, it could be a food allergy, usually to a common protein. And third, it might be something in their environment. You know, pollens, molds, even tiny dust mites. And here's the tricky part. A dog can be allergic to things in one of these categories, or even all three at the same time. Now, let's talk about what you can actually see at home, because you are the #1 observer of your dog's life. Noticing these specific signs is the absolute first, most powerful step you can take to help your vet crack the case. You might see red, angry-looking skin, or even little raised bumps that we call hives. Sometimes their face, especially around their eyes and muzzle, can get kind of puffy and swollen. And hey, it's not always about the skin. Allergies can also show up as an upset stomach or even sneezing fits. But pay really close attention to those recurring ear infections. Seriously, if you feel like you're constantly back at the vet for that same ear problem, it is very often a huge red flag for an underlying allergy. Okay, I need to shift my tone here for just a second because this is incredibly important. While it is very, very rare, the most severe type of allergic reaction is something called anaphylaxis. This is an absolute true emergency. The signs are sudden and they are dramatic. Difficulty breathing, a sudden collapse, or very pale gums. Let me be perfectly clear about this. If you ever see those signs, that sudden collapse, any trouble breathing, pale gums, do not wait. This is not a let's call the vet in the morning situation. You need to go to your nearest emergency veterinarian immediately. All right, so you've recognized the signs, you've made the appointment, and you're at the vet's office. What happens now? Well, it's really important to understand that diagnosing allergies isn't a single test. It's more of a step-by-step process of elimination, and your vet is your partner in this detective work. So first things first, your vet is going to rule out the other common culprits, things like mange mites or a simple flea problem that can look a lot like allergies. If all that comes back clear, the next logical step is usually a very strict food trial to see if a food allergy is the problem. And if that doesn't solve the mystery, we move on to testing for environmental triggers like pollens. See, it's a logical, step-by-step investigation. Now, I really want to zero in on food allergies for a second, because this is something that surprises a lot of pet owners. People often ask about a simple blood test, but honestly, the science is really clear. For food, those tests just aren't reliable. The only way to get a real answer, the gold standard, is a strict food elimination trial. That means your dog eats only a special hypoallergenic diet for about 8 to 12 weeks. I know, it requires patience, but it's truly the only way to know for sure. Okay, so once we have a diagnosis, we get to shift our focus to the best part, relief. It is so important for you to know that even though allergies are usually a lifelong thing, a comfortable, happy, playful life is absolutely achievable for your dog.
We don't just use one tool for this. We use a whole toolbox. The best approach is what we call multimodal, which just means we combine different therapies. This usually includes trying to avoid the allergen when we can, treating any secondary skin infections that have popped up, using medication to control that immediate, frustrating itch, and, for some dogs, using immunotherapy to actually change the immune system's response over the long term.
And for that long-term comfort, there are really two main strategies. You can think of it like playing defense versus playing offense. On one side, you've got amazing defensive tools for just managing the symptoms. These are medications like Apoquel, which is a daily pill, or Cytopoint, a long-lasting injection. They are fantastic at blocking those itch signals to give your dog fast, blessed relief. Then on the other side, you've got the offense, immunotherapy. This is a much slower process. We're talking allergy shots or drops under the tongue, but it's the only treatment that actually tries to retrain and desensitize the immune system to get it to stop overreacting in the first place. And that really brings us to the heart of it all. This isn't just about pills or special diets. True, successful allergy management is a partnership. It's a partnership between you, your vet, and your dog. Your observations at home, your commitment to the plan, and your communication with your veterinarian, those are the most critical ingredients for helping your best friend feel better. So if you remember just one thing from all of this, let it be this. Managing allergies is a marathon. It is not a sprint. But your consistent, dedicated care is what will absolutely transform your dog's life, from one of constant irritation to one of real comfort and joy. Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.